One of the treatments I have special training in is the treatment of pilonidal disease. Pilonidal disease really came to the forefront during World War II when 79,000 soldiers were afflicted with it. It was known as the Jeep driver disease, and the reason was that a lot of the Jeep drivers were getting this, and what we found was that the hair at the bottom of basically the back at the gluteal cleft was impacting into the skin and causing this chronic infection that would come and go every few months. It's a nest of hair that forms basically in the gluteal cleft. The original treatment for this was a full excision down to the sacrum and closure. The difficulty they had with the time was that 50% of these wounds would fail. The average stay in the hospital was 55 days. Most surgeons now that don't have particular specialized training in the treatment of pilonidal disease are treating patients with an open wound technique, and they allow patients to go home and for this to heal over anywhere from 6 to 21 weeks on average. We've come a long way since then. Now we're able to get patients home the same day with a closed wound that has a failure rate less than 5%. What we're doing is utilizing a flap of healthy native tissue from the buttocks to close the defect, which takes tension off the wound and allows for a closed wound that you go home with. It does not require wound dressing changes over a long period. The results in this, in most recent investigations, and there's been several, have demonstrated a recurrence rate of less than 4% and a wound failure rate that with wound infections is less than 7%. These are the best results we can offer of all the procedures available in terms of a flap and a closed wound for the treatment of pilonidal disease. We've been able to successfully use this in our practice to treat countless patients, and the results have been promising, and our patients have all been very happy.